Hello and welcome to our nursing information session. My name is Melissa and I'm so glad that you have joined us today. We're going to go over a few quick questions with Dr. Dwinnells, our director of the nursing program here at Kent State University at Trumbull. If you'd like to get a sneak peek and see the outline, you can check the comments below this video. You'll see all the questions we're going to cover, but I hope that you'll watch the whole thing. We're going to keep it pretty brief and to the point. First, we're going to find out about how to get into the nursing program and what exactly a BSN at Kent State Trumbull entails. And then we're actually going to hear from a current nursing student, Natasha, and she's going to show us a little bit around the nursing lab. So thank you again for joining us today. Welcome, Dr. Dwinnells. Would you like to introduce yourself?
Hi, everyone. I'm Kathy Dwinnells, Dr. Kathy Dwinnells. I've been a professor at Kent State Trumbull for about 27 years. I've been the coordinator for about 8 years. So coordinating is sort of like a director position. My area of expertise in the past was pediatrics. I currently teach human growth and development and pharmacology, and I do sophomore level clinical orientations. So that's what I'm doing now.
Thank you. And one of your favorite things to talk about, I know, is nursing. So why should somebody choose nursing? Why would you encourage someone to do the program?
You know, I think the really wonderful thing about nursing, it's a very rewarding career. And for me, it's really an easy choice. When I was 3, I was going to be a nurse. When I was 4, I was going to take care of kids. So I never, ever had a plan B. I think that it's a flexible career. I think when people think of nursing, they tend to think that everybody works in the hospital, and that's not so. There are so many opportunities for RNs anymore. We've had students that worked in the jail. We've had students that were cruise nurses. We've had students that were traveling nurses. We've had students in the community, students as school nurses. So I think that the possibilities for employment are really limitless. There are so many. We've even had nurses that work in factories. Some of you may not know that GM had a nurse just for the plant. So there are a lot of places that RNs could be employed. Aside from the fact that it's a good salary, that's kind of secondary. I mean, you have to have a passion for people. You have to have a passion for helping people. But again, the opportunities are so endless, and there's so many things that you can do as an RN, and I think it's very rewarding. So I think that's probably one of the biggest reasons people want to choose it, is to help people.
Awesome. Thank you. And so let's say someone has decided they want to be a nurse. They're looking at Kent State Trumbull's program. How do they actually get into the program?
So Kent State BSN program, or Bachelor of Science Nursing program, is the same program that Kent State main campus offers. The only difference is we are regional. So we tend to serve people in Warren, Cortland. So when you apply, as if you were to apply to Kent State University, you would apply to the Trumbull campus. And you would apply as a nursing student. Typically, the first year you would take your sciences, because the undergraduate requirements are that you have anatomy 1 and 2, that you have chemistry, and that you have microbiology. Once you do that, the application process would open in February of your freshman year and would close in May. So once you have your sciences, or going to be finishing your sciences, you would go ahead and apply to the program. So your first year is basically prerequisites. Once you get into the program, we only take students in the fall. Then you have 3 years to finish the program, and you come out with your bachelor's degree. We do, the minimum GPA is 2.75. We have students that range anywhere from 2.75 to 4.0. Our average GPA at the Kent Trumbull campus is about a 3.4 to a 3.5. They do separate out the science GPAs from your general GPA, only because they found that students that did pretty well in science were more apt to pass the nursing boards their senior year after they graduate. So basically it's a 4-year program. However, the first year is prerequisites. Your second, third, and fourth year are when you're actually in the nursing program. So it does take 4 years to complete.
All right, thank you for explaining that. And there's also a link below this video if you want to take a look at the nursing roadmap and just get an idea for what classes you would take each semester. It's give or take a few, and your advisor will coach you through all of that, but it gives you a nice idea of what's involved in the program. So our next question is, what kind of nurse does this program prepare me to be? I know there's LPNs, there's RNs. What are we looking at for this program?
When you graduate from Kent State Trumbull's BSN program, again, Bachelor of Science in Nursing, you will have a 4-year degree. hence it's a bachelor's degree. You will then take what they call the NCLEX board. So you have a nursing board that you have to take in order to work as an RN. So once you graduate with the nursing program, you have a bachelor's degree, but that's only halfway there. You still have to take a board. You can take a board in any state. So we've had students that graduate from our program and then we just had a student last year move to Alaska. So she took the Alaska boards. You can take the boards anywhere in the country. You can get reciprocity. So you say you take the boards in Ohio and you decide to move to New York, that's fine. You don't have to take the boards over. You just have to pay a fee and prove that you have an Ohio license. So the only state that requires that you retake the boards is California. So if you decide to move to California, you will have to take new boards. Once you pass those boards, then you'll be known as a registered nurse. So your bachelor's degree gets you, that's the first step, but without passing your boards or your NCLEX, which is your state nursing board licensing test, you really can't work. So what we do is we try to prepare you so that you are able to take this board so that then you can work as a registered nurse or as an RN.
Gotcha. Awesome. And you already kind of covered a lot of the variety within the nursing profession, travel nursing, home health. Is there anything else you want to mention about opportunities there?
I think that I just kind of want to emphasize that the opportunities are really endless. And I think I think you have to get your mind away from the fact that nursing, no, there are people that love bedside nursing. There are people that have been in the hospital at the bedside for 30, 40 years. That's wonderful. We need those people. But if you're the type of person who says, I really don't know if I want to do that, or that's your idea of nursing is that you're working in a hospital 12-hour shifts, that's not true. So we have people, again, school nursing is wonderful for people that have kids. They take their kids to school. They're the school nurse for the day. And everybody drives home together. So that's kind of like the options, the opportunities that are there that are not so limiting.
Awesome. All right. So next question is, what happens if I don't get into the program?
You can, and this is what some students struggle with. When you apply to Kent State's nursing program, you can only apply to one campus. So you can't say, well, I'm going to apply to the Kent campus, and I'm going to apply to Trumbull campus, and I'm going to apply to Salem campus, and whoever takes me, I'll go there. That's not what you're able to do. We've had students in the past that don't get in. You can always reapply the following year. You can apply to another campus if you so choose to do that. So there are other options. We don't have a lot of your prerequisites that you have can help you with another major. Let's say you didn't get into nursing, you're not sure you want to do it. A lot of the prerequisites that we offer as part of our nursing program will apply to physical therapy assistant, occupational therapy, public health. So a lot of those are crossovers. But if you didn't get in the first time and you really, really want to do this, nothing stops you from reapplying. You might have to do a couple extra classes, maybe get your GPA up, that kind of thing. But for the most part, the only reason, probably the most reasons that people don't get in is their GPA is not at 2.75, or they do not have the required sciences in order to get done.
All right, thank you for explaining that. Now, how does this program compare with other nursing programs?
In the area, the one that's probably the most competitive with us is YSU. They're the other college that offers a 4-year degree. A lot of the same classes, a lot of the same type of curriculum we offer that they offer. I will tell you that Kent State's NCLEX pass rate is much better than YSU. Trumbull's pass rate has been over 90% for the last 7 years. I think in 2017, we were the only campus in the whole area that had 100% pass rate. That meant that all of our students who took the nursing boards passed. Generally, when I say it's above 90, it depends on the graduating class. The last several years, we've only had one student not pass. And because we have smaller classes, that puts us at sometimes 92, 93%. So we have a very good pass rate, and we have a better pass rate than some of our competing universities as well. But we do offer the same degree as they do, just different maybe curriculums, different class, different offerings in the class, but it's very similar. But I think Trumbull, Kent State in general, prepares our students better for the NCLEX boards.
Sure. Plus that regional feel too is the smaller class sizes really helps, I think, with something as tough as nursing.
Right, and I think, Melissa, you could probably attest to that. I know several years ago, I always use these two. We had two students that had applied for the Kent campus and they didn't get in. And so they offered them positions at the Trumbull campus. And for the first, I would say, semester, maybe 2 semesters, they were madder than wet hens because they didn't want to come to regional. They wanted to go to main campus, live in the dorms. They ended up becoming our poster kids. They loved it. They loved the smallness. Typically, our big class is 30 people. So we get to know you. We know your name. If you don't come to class for a couple of weeks, we find you. We have pretty much an open door policy. I think Natasha can probably have add to that, but I think that we are much more on a personal basis. I know the class that I teach, human growth, the most I've had is 40 students, and they have over 200 at the Kent campus in a big auditorium. So I think there's differences that make us kind of unique among campuses, which I like. I like the smallness. I like the fact that they know us, we know them, and we know everybody's first name, last name, families, shoe size, everything.
That's great. Perfect segue into hearing from one of our current nursing students. We have Natasha on with us today, and thank you for being here. She's going to give us a little tour of our nursing lab.
Hi everyone, thank you for joining us today. My name is Natasha. I'm a first year nursing student, and here on my screen is what our nursing lab looks like. So you see here we have the tables and chairs, so we sit and take our lab lecture right in the lab room, the simulation. So the professors will stand up here and teach the lecture right on the board if they need to, like a usual class. But we also have a bunch of mannequins a lot along the outside of the room here. I'll show you some of them. Each of these rooms mimic what a hospital room would look like, and they're pretty spot on, just about even to the chairs that we get patients up into, the bedside tables. The beds all move the way hospital beds would. They're a little older, but it's the same idea. The little bedside table, nightstand, the oxygen monitors, and suctioning, even up to the clock and gloves. So the mannequins all move. They all have like joints and whatnot, so they kind of mimic how real people would be. They can put IVs in some of them, catheters. We practice putting NG tubes in them. We practice wounds. We practice just doing a head-to-toe assessment on them. So we get a pretty good idea of what it's actually like taking care of a real patient, aside from they don't talk, but sometimes the professors will step in and make them talk. So I'm going to show you our simulation mannequin. So we have two of these. This is the pediatric one, but we also have an adult one in the room further down the hall. So these mannequins are actually really cool. They do a lot more than what the mannequins in the other room do. They're basically as if they are a real patient. So there's this little room back here behind, it's a mirror, but there's a room back there. And the professors who's teaching the simulation will control this mannequin. So the mannequin will have a heart rate, blood pressure, respirations, it'll breathe, it blinks, they can make it talk. So it's pretty much like a real person. And then we will run like an actual simulation on them. So like we'll give them pain medicine, we'll assess their vitals. They bring an IV pole, so we practice IVs. So it gives you a really good idea what it's actually like to work in the hospital taking care of a patient. So this is my first year. I just finished. We had 2 labs so far. So we just practice putting in catheters and G tubes. We practice a lot with wounds. We practice giving shots and injections. We learned a lot this semester. I'm sure I'm missing quite a bit, but I really enjoy it. I really enjoy going to Kent State Trumbull. I enjoy all of my professors. They make you feel like they actually care. You can talk to them about school, about outside of school. They really help you, and I could not be happier with coming here. Like, I'm so glad I made the decision to come to Kent State Trumbull.
Oh, thank you, Natasha. Thank you for showing the lab too. Super cool. I'm going to show a quick video in case anybody's wondering what the lab looks like with actual people in it. It's just a 60-second little video. We did the renovations 2 years ago, maybe?
2 years.
2 years, okay. So it's been really cool to, have students in here, mostly pre-COVID. This is the debrief room. Oh, there's people in there.
Yay.
And then for myself, I didn't actually get to use this lab because I graduated from the nursing program in 2019, right before the new lab happened. But I can just second everything Natasha said. The professors were just absolutely supportive, and clinical groups were even smaller than the class size. So it's us at the hospital with 5 classmates and our professor, and we are just there. We have lunch together, we get to know each other's lives, and even what's going on in each other's family, and talk about our tests and our quizzes and our homework, and just really, really personable experience. And
if I could say something about the lab too, Melissa, and I'm glad you said something about the clinical, because the clinical groups are small. We've gone down to probably no more than 6 in most instances, but that is also in the lab. We have very small groups. Usually there's no more than 8. Natasha, how many people did you have in your lab group? You had 6, right?
Yeah, we had, actually not, yeah, we had 5.
5, okay.
So
Right, so 5 or 6. So you basically typically had your own mannequin.
yeah,
Which is nice. So, we have plenty of mannequins so that the students could either buddy up, or if in some instances they were practicing by themselves, they had their own mannequin. So, which is really, advantageous.
we were also, because of the small lab size, we were able to each practice doing a whole procedure with Mrs. Walker, and still have plenty of time to do other stuff or just do it again. And we were not very quick at doing this because it was our first time putting
Right.
it in YouTube, so that was pretty nice.
But you had plenty of time because you didn't have a lot of people in the labs, and so you got a lot of one-on-one.
Yeah.
And I think that's a good point. Yep.
And then just overall, the whole nursing program, for myself, I feel very prepared for entering into the workforce. I'm currently taking a little break to get my master's, but when I go for that job as a bedside nurse, I know not just the science behind the nursing, like those lab values and pathophysiology and stuff, but also the skills that we learn that you can't really teach in a textbook, like prioritizing or delegating, all those things that make a good nurse more than just book smart. I feel like we really got that education here at Kent State Trumbull. So I'm super thankful, and really, really good quality for your money. I mean, I was able to, find different nursing scholarships around here. With the nursing shortage, a lot of places are wanting to help fund nursing students that are going to school. So we have that in our favor. So reach out, please contact us if you have questions. Dr. Dwinnells' contact information is going to be below this video. Mine as well. If you have questions about the application or about the nursing program or anything, please let us know. We're more than happy to help. And thank you, Dr. Dwinnells, and thank you, Natasha, for being on today.
Thank you, Melissa.